In this video, we'll see about the larynx. So, larynx, it is the upper part of the so the learning objectives of this topic is at the end of this video. I will know about the level and extent of this larynx, its cartilages, the ligaments, extrinsic and intrinsic ligaments, the cavity of the larynx, how it looks like, the muscles of the larynx, blood supply, lymphatic drainage, nerve supply, and clinical anatomy. Okay. So the larynx, it is the upper part of the respiratory tract. Its main function is to protect the lower respiratory tract so that the foreign bodies do not enter the trachea. So suppose if a foreign body enters that larynx, it reflexly gives rise to violent coughing till the foreign body is expelled. So that's why the larynx is otherwise called as watchdog of the lungs. Okay. So another function of the larynx is the protection of voice, hence you name it as voice box. Okay. So this picture on the left side shows a cavities. So this is the nasal cavity, this is the oral cavity, and the green color structure at the back is the pharynx, and this is the larynx. Okay. So what's the extent of the larynx? So it extends from the C3 laryngeal inlet to the trachea, where it is continuous as trachea. So the vertebral level is from C3 to C6. Okay, it's located in front of the neck, yes, opposite the cervical vertebra C3 and C6. It moves vertically up and down during swallowing and phonation. Okay, so what is the framework of this larynx? So the larynx is made up of cartilages and membranes. And these muscles, these laryngeal muscles, so they primarily move the cartilages through them, the vocal cords, during respiration and during speech, that is during phonation. So that's the extent of the larynx. It extends from the laryngeal inlet, that is the C3, up to the C6 level, where it continues as trachea. So this larynx is different in infants when compared to adults. So how it differs? It is smaller and funnel shaped in infants, and it is softer and easily collapsible. So the laryngeal cartilages are softer in children, and it is easily collapsible, and it is situated at a higher level than in infants. So the upper margin of the larynx rests at the level of axis vertebra in infants, whereas it at the level of C3 in adults. Okay, and the epiglottis is narrower and deeply grooved. Which is more suited for protecting the air passage during suckling. Since infants suckling, this adaptation in the epiglottis helps to protect the air passage. Okay, and then the submucosa is thicker in infants, so that's why it becomes edematous faster after irritation. Hence obstruction of airway is more common, takes place faster in infants when compared to the adults. And the subglottis, which is the subglottis in the infants is directed posteriorly as well as inferiorly. So this point has to be borne in mind during endotracheal intubation. So these are the differences in adult and the infants. Okay, so in infants, the larynx is smaller and it is funnel shaped and narrower than the adult. Yes, and the laryngeal cartilages are softer and collapsible easily, and then it is placed at a higher level. So at the upper margin actually rests at the level of axis vertebra in infants, and this epiglottis is longer and deeply grooved, which is more suited to protect the air passage during suckling. Okay, and this submucosa is thicker in infants, and hence it becomes edematous faster than in adults. That's why the laryngeal obstruction is faster in infants, and this the subglottic part is posterior and inferiorly placed, So this direction has to be borne in mind during endotracheal intubation in infants. Okay. So coming to the differences in the male and female, yes. So in the male you see a prominent thyroid cartilage in the front, so that you call it as Adam's apple. Yes. So until puberty, the larynx of the male and differs only little from the female. So after puberty, what happens to the larynx in the male? It goes rapidly due to increase in size of the laryngeal cartilages. Okay, so after puberty, the laryngeal cartilages increase in size. That's why the larynx grows rapidly. So the laryngeal prominence, what you call it as Adam's apple, becomes prominent in males. This laryngeal prominence is produced to the decrease in the thyroid angle. So thyroid cartilage is one of the unpaired cartilage of the larynx. We'll see later. So these two thyroid laminae, so they meet in the center anteriorly. That angle is decreased in males. So that's why it's more prominent in males. That angle of 90 degree in male and 120 degree in female, and the length too differs. The length of the vocal cord differs. It's 24 millimeter in male and 16 millimeter in female. So and because of these findings, these differences between the in male and female, the voice is low pitched in males and high pitched in females and infants. Okay, so that's the differences between male and the female. So the laryngeal prominence is more prominent in male, that you call it as Adam's apple, and the angle between this is 90 degrees in male and 120 degree in females. That is the angle between the thyroid laminae, and the length of the vocal cord is 24 millimeter in male and 16 millimeter in female. And so because of these differences in the anatomy, the voice is low pitched in male and high pitched in females. Okay, so this picture again will show you the extent of the laryngeal larynx. Yes, it extends from the laryngeal inlet. Yes, I hope you remember the boundaries of laryngeal inlet. The laryngeal inlet is bounded anteriorly by the epiglottis and laterally by array epiglottic fold and posteriorly by the interarytenoid folds. So that is the laryngeal inlet. So anteriorly by the epiglottis, laterally by the array epiglottic fold and posteriorly by the interarytenoid fold. So that is at the level of C3. Yes, and it ends at the level of C6 where it continues as trachea. So that is the extent of larynx from C3 to C6 cervical vertebral level. Okay, so as I told you, the larynx is the framework. The framework of the larynx is composed of cartilages and membranes, and these laryngeal muscles which are attached to this cartilages move it, and through them the vocal cords are moved during respiration and phonation. Okay, so the cartilages are 3 paired and 3 unpaired cartilages. The 3 paired are arytenoid, cornicate and cuneiform. The 3 unpaired are thyroid, cricoid and epiglottis. We'll see one by one. So the first unpaired cartilage is the epiglottis. So it's a leaf shaped. Yes, the epiglottis is a leaf shaped structure, and it is an elastic cartilage. So it is an elastic cartilage. It forms the anterior wall of laryngeal inlet. Yes, the laryngeal inlet is bounded anteriorly by this epiglottis. So it has two ends. So this is the upper end and this is the lower end, and two surfaces. This is the anterior surface, and what is seen here is the posterior surface, and two lateral borders. This is one lateral border and this is one lateral border. Okay, so what about the upper end? How does the upper end look like? It is free. Yes, it is not attached to anything. So the upper border is free and it is broad. Yes, when compared to lower end, it is broad. The upper end is free and broad. The lower end is narrow and pointed. Lower end is, so this is the lower end which is narrow and pointed, and this is the upper end which is free and broad. So surfaces. This is the anterior surface. The anterior surface is related to the base of the tongue. Yes, base of the tongue, and it is this part. This is the anterior surface. Part is covered by stratified squamous epithelium, and it is connected to the tongue by means of three folds. Yes, I hope you remember when you read about the tongue. Three mucosal fold, median and lateral glossoepiglottic fold. So between the tongue and the epiglottis. Okay. So each, that's about the anterior surface. Okay, so the anterior surface in the upper part is covered by stratified squamous epithelium, and it is connected to the tongue by three mucosal folds. And the lateral margin, so this each lateral margin, this lateral margin provides attachment to the aryepiglottic fold in its lower part. Then this posterior surface, you see some pits in the posterior surface. Yes, so these pits are produced by the small mucosal glands. Yes, you can appreciate the pits there. So small pits, these pits are produced by the mucus glands. So on this posterior surface, the epithelium is respiratory in the lower part and stratified squamous in the upper part. Okay, so this is again similar to the anterior surface. So it is the upper part of both the anterior and the posterior surface is lined by stratified squamous epithelium, while the lower part is lined by the respiratory epithelium. And in the posterior surface, you can see the pits that is produced by the small mucus glands there. Okay, so that's about the epiglottis. Epiglottis is leaf-shaped structure. It's an single cartilage. It forms the anterior wall of the laryngeal inlet, and it has an upper end which is broad and free, lower end which is narrow and pointed, and it is attached to the thyroid cartilage by this thyroepiglottic ligament. Yes, by this thyroepiglottic ligament. And it has two surfaces, anterior surface and posterior surface. So the anterior surface, it is it's in relation with the tongue, and it is connected to tongue by three mucosal folds. Is median and lateral glossoepiglottic folds. In this the upper half of the anterior surface and posterior surface is lined by this stratified squamous epithelium. The lower half of both the surfaces are lined by respiratory epithelium, and in the posterior surface you see small pits there, that is produced by this small mucosal glands there. Okay, and then you have this the two lateral margins. So you have two lateral margins. This gives attachment to the aryepiglottic fold in its lower part. So these are the features of epiglottis. Okay, so coming to the next single cartilage, that is cricoid cartilage. Okay, so it has some peculiar features, this cricoid cartilage. So it is the only cartilage of the larynx that forms a complete ring around the cavity of the larynx. Yes, so it forms a complete ring. Yes, it completely encloses the laryngeal cavity. Yes, so only cartilage of the larynx that comes a complete ring around the cavity of the larynx. Its shape is like a signet ring. Yes, it is shape of the signet ring, and it has a broad lamina posteriorly. Yes, so this is the posterior broad lamina, and this is the narrow arch. So this is the arch of the cricoid, and this is the lamina, quadrilateral lamina. So the posterior the parts of the cricoid cartilage are posterior quadrilateral lamina and the anterior narrow arch. Okay, so this cricoid cartilage is of hyaline variety. Yes, so this unlike the epiglottis, which is elastic cartilage, this cricoid cartilage is a hyaline variety, hence it is prone for calcification and ossification. Okay, and this thyroid cartilage is an important landmark for the certain events at the neck. Okay, so this arch, this narrow anterior arch can be felt in the midline below the thyroid cartilage, and it corresponds to the C6 level. Again, it corresponds to the C6 cervical vertebra level. Okay, so at this level, the larynx continues as trachea and the pharynx continues as esophagus. Okay, and this only cartilage, this cricoid cartilage is the only cartilage that articulates with the thyroid cartilage and also with the arytenoid cartilage to form the synovial joints. Okay, so hence this cricoid cartilage is crucial for the movements of the vocal cords. So that's why it is called as the foundation stone. Okay, so this cricoid cartilage articulates with the arytenoid and the thyroid cartilage to form the bilateral synovial joint, and it's the only laryngeal cartilage that articulates with the other two laryngeal cartilages. And so the cricoid cartilage is crucial for the movements of the vocal cords. Hence it is known as the foundation stone. Okay, and the other events that takes place at C6 level is the level of middle cervical sympathetic ganglion. The inferior thyroid artery enters the thyroid gland at its level, and the recurrent laryngeal nerve enters the larynx behind the cricothyroid joint. So this is the cricothyroid joint. So behind this, the recurrent laryngeal nerve enters it. Okay, so you can see the facets in the upper border of the posterior quadrilateral lamina on either side for articulation with the arytenoid cartilage, and the posterior part of moreover the lateral part of this narrow anterior arch bears a facet for articulation with the inferior horn of thyroid cartilage. Okay, so this is the posterior view on the right side. So where you see a central ridge, and you have depressions on either side of the ridge. So this is how the cricoid cartilage looks like. Okay, so the cricoid cartilage is the foundation stone of the larynx, and then it is the only cartilage of larynx that forms a complete ring around its cavity. It shapes like a signet ring, and its parts are a broad lamina, quadrilateral lamina posteriorly, and a narrow arch anteriorly. And this cricoid cartilage is of hyaline variety and hence prone for calcification and ossification with age. And this acts as an important landmark for various events that takes place at the level of C6 cervical vertebra. So coming to the next cartilage, unpaired cartilage, is the thyroid cartilage. Yes, thyroid cartilage. So it is the largest. It is the largest cartilage of the. It's the largest among the other cartilages. So it's made up of hyaline cartilage. Yes, this too is made up of hyaline cartilage. Hence, it's tend to calcify and ossify as age advances. So, out of the three unpaired cartilages, the epiglottis is elastic, the thyroid and cricoid are hyaline cartilages. Okay, so you have 9 pairs of muscles are attached to this thyroid cartilage. Okay, so coming to the parts of this thyroid cartilage, it has 2 quadrilateral lamina. So this is the lateral view of the thyroid cartilage. So you can see this is the quadrilateral lamina. So it consists of 2 quadrilateral lamina which meet in the midline anteriorly. Yes. So this is the lamina one side, this is the other side. So these two meet anteriorly at a thyroid angle. So that point we call it as thyroid angle. So that is the angle is 90 degrees in male. That's called as laryngeal prominence or Adam's apple. Yes. So this part is subcutaneous and easily palpable. Yes, the laryngeal prominence. This part is easily palpable as it is subcutaneously placed. Okay. Then the parts of the thyroid cartilages are it's made up of two quadrangular plates that meet in the midline anteriorly, and each plate has two surfaces. Yes, this is the outer surface. What you see here is this outer surface, and inside is the inner surface, and it has four borders. That is the anterior border, you have this posterior border, upper border, and lower border. Okay, so its thyroid cartilage is made up of two quadrangular plates, and each plate has two surfaces: outer surface, inner surface, and four borders: upper border, lower border, anterior and posterior border. So we see about the anterior border already. So this part where it is the anterior borders are separated here, this part we call it as thyroid arch. This is the thyroid arch. Okay. So when you see in the posterior border, it's a thickened. This is the posterior border is thickened upwards and downwards. Yes, the thickened upwards and downwards as prolongations called superior and inferior horns. Is called as, this is the superior horn and this is the inferior horn. Okay. So this posterior border receives insertion of the stylopharyngeus and the palatopharyngeus muscle. Okay, so this posterior border receives the insertion of stylopharyngeus and the palatopharyngeus muscle. And this superior horn gives attachment to the lateral thyrohyoid ligament, whereas the inferior horn, see inferior horn, it bears a circular facet on its medial surface near the tip for an articulation with the lateral surface of cricoid cartilage. Yes, cricoid arch. So the anterior part of cricoid, you call it as cricoid arch. So in the lateral surface it bears a facet for articulation with the inferior horn of thyroid cartilage to form the cricothyroid joint. That was a synovial variety. Okay, so this is the upper border. So that is the posterior border. The posterior border thickened and prolonged upwards and downwards as the horns. Call it as horns or conveyor. This is the superior horn and this is the inferior horn. And the posterior border receives insertion of stylopharyngeus and palatopharyngeus muscle, and the superior horn gives attachment to the lateral thyrohyoid ligament, and inferior horn it bears a facet on the medial surface for its articulation with the cricoid arch to form the cricothyroid joint, which is a synovial variety. Okay, so coming to the upper border or superior border, so here it presents a tubercle there, that is the superior thyroid tubercle. Superior thyroid tubercle that is present in front and front of the root of the superior horn. Thyrohyoid ligament is attached to this. Yes, thyrohyoid ligament is attached to this border. So the lower border, how does it look like? It is concave posteriorly but straight anteriorly. Yes, it's straight anteriorly and concave posteriorly, and it represents a inferior thyroid tubercle. So this is the superior thyroid tubercle and the superior border. Here is the inferior thyroid tubercle. So this gives attachment to thyrohyoid ligament. So this inferior tubercle gives attachment to the thyrohyoid ligament, cricothyroid ligament. The superior tubercle gives attachment to thyrohyoid ligament. So when you connect these two, a line is there, that is the oblique line of thyroid cartilage. Okay, so the line connecting the superior and inferior thyroid tubercles on the outer surface of each lamina is the oblique line of thyroid cartilage. So this oblique line gives attachment to sternothyroid, thyrohyoid, inferior constrictor of pharynx, and the pretracheal layer of deep fascia. Okay, so these are the structures that are attached to this oblique line. Yes, sternothyroid, thyrohyoid, inferior constrictor of the pharynx, and you have the one more structure attached to that is the pretracheal layer of deep cervical fascia. So that's about the outer surface. The inner surface of the lamina is smooth. Its upper and the posterior part is covered with the mucous membrane of the larynx. So the inner surface of the lamina is smooth. Okay. So these three ligaments are related to that is thyroepiglottic, vestibular and the vocal ligaments. So coming to the pad pad laryngeal cartilages. So of this the important is the arytenoid cartilage. So where is this arytenoid cartilage placed? See, so this is the location of arytenoid cartilages. So this is the location of thyroid cartilage, arytenoid cartilage. It is placed on the upper border of lamina of the thyroid cricoid cartilage. So arytenoid cartilage is placed on the upper border of lamina of the cricoid cartilage. Each arytenoid is pyramidal in shape. Yes, so this is the shape of the arytenoid. It is pyramidal in shape, and it has an apex. So this is the apex and this is the base. So apex and base and three surfaces you have. So this is the anterolateral surface, medial surface and posterior surface. Okay. So this arytenoid cartilage is placed on the upper border of lamina of the cricoid, and it is pyramidal in shape with an apex and base and three surfaces: medial surface, anterolateral surface and the posterior surface. So when you look into the base, it has a facet. Yes, it has a facet for articulation. So this is the facet at the base for articulation with the cricoid. Yes, so here see the articulation of the cricoid with arytenoid. So the base has a facet by which articulates with the upper border of the cricoid lamina, and it process two processes. Yes, one is the muscular process and another is the vocal process. The lateral angle of the base, you see a projection, that is the muscular process. The anterior angle of the base, it projects forwards as the vocal process. Okay, so the lateral angle of the base, it projects laterally as the muscular process, whereas the anterior angle of the base projects forwards as the vocal process. So these are the parts of the arytenoid cartilages. The arytenoid cartilage is situated, placed on the upper border of the lamina of cricoid. It is pyramidal in shape, which has an apex, base, medial surface, anterolateral surface and the posterior surface. Okay, and the base, it bears a facet for articulation with the lamina of the cricoid cartilage to form cricoarytenoid joint, which is a synovial variety. And in the base, the lateral angle of the base projects laterally as the muscular process, where the two muscles are attached, that is the posterior and lateral cricoarytenoid is attached, and here the anterior angle of the base projects forwards as the vocal process. Here the two ligaments are attached, that is the vestibular and vocal ligaments are attached to this vocal process of arytenoid. So the muscular process, two muscles are attached, that is posterior and lateral cricoarytenoid. In the vocal process, two ligaments are attached, that is the vocal and the vestibular ligaments are attached. So the cornicate and the cuneiform are small nodules that are present in the within the apex of the arytenoid, yes, and in the aryepiglottic fold. So the cornicate and the cuneiform are small conical small nodules which are present in the so the cornicate cartilages are small conical nodules which articulate with the apex of the arytenoids. they lie within the posterior part of aryepiglottic fold. So both the carniclate and the cuneiform cartilages are located in the aryepiglottic fold. So that is between the arytenoid and the epiglottis. Okay. So coming to the membranes and ligaments. So you have extrinsic ligaments and intrinsic ligaments. So the extrinsic ligaments are present outside. The intrinsic ligaments, they lie beneath the mucous membrane of the larynx. Okay, so these are the extrinsic ligaments: the thyrohyoid membrane, cricotracheal ligament, cricothyroid ligament, hyoepiglottic ligament. The intrinsic membranes are quadrangular and cricovocal ligament. Okay, so this you can appreciate in this picture. You can appreciate this. So this is the aryepiglottic fold, yes, right? So this is aryepiglottic fold, and you can see the situation of this small cartilages, that is the carniclate and the cuneiform in the aryepiglottic fold. So carniclate actually it is within the apex of the arytenoids. Cuneiform is in the front of the carniclate, and it is within the aryepiglottic fold. The extrinsic membranes of the larynx, they lie external to the cavity of the larynx, whereas the intrinsic membranes are on the inner aspect of the laryngeal mucosa, inside the laryngeal cavity. So we will see the intrinsic membranes first. That is a quadrangular or the quadrate membrane, which is a fibroelastic membrane. It stretches between, so this is a quadrangular membrane. Quadrangular membrane or quadrate membrane. It's a fibroelastic membrane, stretches between the epiglottis. Yes, it stretches between the epiglottis and the arytenoid and to the thyroid angle. Okay, so that is the extent of this quadrangular or the quadrate membrane. Its upper free margin is in the aryepiglottic fold. Yes, so this is the aryepiglottic fold, that is the upper free margin of this quadrangular membrane. Its free lower margin forms a vestibular ligament. Yes, this is the free lower margin of this quadrangular membrane. It forms a vestibular ligament which extends between the thyroid angle anteriorly and the vocal process of the arytenoids. So this is the vocal process. As I told you, the vocal process of the arytenoids, the vocal ligament and the vestibular ligament are attached, and to the muscular process of the arytenoid, the two muscles, that is the posterior and the lateral cricoarytenoid muscles, are attached. So this is the extent of this quadrangular or quadrate membrane. So this is fibroelastic membrane stretching between the epiglottis, arytenoid and the thyroid angle. So the part of the ligament is cut to expose the cavity there in this picture. Okay, so this upper margin is free, is in the aryepiglottic fold. So this is the aryepiglottic fold. So there lies its upper margin, while its lower free margin, so this is the lower free margin which forms the vestibular ligament that stretches between the thyroid angle and the vocal process of the arytenoids. So above the attachment of vocal ligament. So this is the attachment of vocal ligament. So above the attachment of the vocal ligament, you have this vestibular ligament, which is the lower free margin of quadrangular membrane. Okay, so coming to the next intrinsic membrane, that is the cricovocal membrane. It's a triangular fibroelastic membrane. Yes, so this that is colored yellow is the cricovocal membrane. So it's a triangular fibroelastic membrane that stretches between the cricoid. So this is the cricoid, arytenoid and the thyroid. Okay, so between the cricoid, arytenoid and the thyroid, you have this triangular membrane, that is a cricovocal membrane. So its upper free margin extending between the midline of the thyroid angle to the tip of the vocal process is called as vocal ligament. Yes, So the lower free margin of the quadrangular membrane extending between the vocal process to the thyroid angle is the vestibular ligament, and this upper free margin extending of cricovocal membrane extending between the middle of the thyroid angle and the tip of the vocal process of arytenoid is the vocal ligament. Okay, so this lower margin of cricovocal membrane is attached to the arch of the cricoid cartilage, and this cricovocal membrane of the either sides are continuous across the midline, and it forms the conus elasticus. Okay, so conus elasticus is the cricovocal membranes of two sides are continuous across each other in the midline. So the midline part of this cricovocal membrane is conus elasticus. So that's about the intrinsic membranes of the larynx. So coming to the extrinsic membranes. So here in this picture you can appreciate this one membrane, that is the hyoepiglottic ligament. Yes, so you can see very well this the hyoepiglottic ligament here, that is extending from the between the hyoid and the epiglottis. That is the hyoepiglottic ligament. That is one of the extrinsic ligament. So this is the view of the larynx. After removing a part of this in the posterior view of the larynx, after removing in the cross section, so you can see the other three extrinsic membranes here. So this is the thyrohyoid membrane. So thyrohyoid membrane between the upper part of the upper border of thyroid cartilage and the upper border of body and the greater horn of the hyoid bone. So this is the thyrohyoid membrane. So this membrane is pierced by the internal laryngeal nerve and the superior laryngeal vessels. So thyroid membrane stretches between the upper border of thyroid cartilage and the upper part of body and greater horn of hyoid bone. So this membrane is pierced by the internal laryngeal nerve and the superior laryngeal vessels. So this ligament is thickened in the center and it is called median thyrohyoid ligament. Okay. So then next ligament is the cricotracheal ligament. So this is the cricotracheal ligament, that is between the cricoid, lower margin of cricoid and the first tracheal ring. Okay. So the next is the cricothyroid ligament, that is in the midline anteriorly. Okay. So these are the extrinsic ligaments that are present in the larynx. So you have 2 intrinsic ligaments and 4 extrinsic ligaments of larynx.